Nursing students, time to talk.
Okay.
We're just gonna start. Yeah, we're gonna start off like this.
Okay.
All right. So, welcome to the Real Talk School of Nursing podcast. I'm your good and faithful host, Michael Smith, and with me today is
Emily, the nurse extraordinaire.
That is awesome.
Is that better?
Yeah, that's way better than you practice. I'm like, a nurse?
I felt a little bad after you looked at me like that.
Like, that story, it's so compelling the way you tell it. All right, so let's jump right into it. So, let's start way back at the beginning. So, you are 18-year-old Emily, and what brought you into nursing in the first place?
I really have kind of felt a calling towards healthcare ever since my teenage years. I've been a nursing assistant since I was 17. And ever since then, I pretty much knew that I wanted to be a nurse. I wanted to go on and be a nurse. I just always felt compelled and kind of felt the nurse calling, if you will, to help people.
So was it a desire to help people, or was it a desire to, but what gave you the interest to go, to become an NA?
A nursing assistant?
Yeah. Was your mom a nurse, or your grandma a nurse?
No,
or
there's not really a lot of healthcare. I know you hear about that a lot. Like, people have moms, sisters, everybody in their family's a nurse. And I'm the only nurse in my family.
So what was the driving factor behind all that?
I really don't know. I don't know. Just something innate.
Oh, that's great.
Yeah. No, just, I just loved it. And when I was, even a little bit younger, more in adolescence, I remember I had a family member who was ill and was in the hospital a lot. And when we would go to visit, being in the hospital and always just kind of having this fascination in the hospital, wow. I just was almost, not mesmerized, but just kind of wow, who are these people and what are they all doing? And, it sparked my interest way back then. So I don't know if maybe that had something to do with it. But always kind of knowing that I wanted to get into that field.
So, on the previous recorded podcast, I talked a little bit about what eventually made me choose with a random text sound going on in the background, what made me choose, or what criteria did I use in order to choose the program that I went with. So was there, what made you choose the initial program that you went through to get your RN? Because you did an associate's first, right?
Correct.
Okay. So was there a career day that you went to? Because I assume you made this decision while you were still in high school, or did you wait a few years?
I waited just a little bit. There was a little bit of back and forth. I was working as a nursing assistant. I knew that I wanted to do something in the healthcare field. At that point, I wasn't exactly sure if it was nurse or if maybe social worker or something along those lines, something to help people. So for 1 year out of high school, I went to a private college, and then quickly found out that that was not the path for me. I didn't actually want to be a social worker, and I didn't want to continue paying $18,000 a year to go to private school. That was an expensive year.
Yeah. But I mean, I think it takes a lot of, did you have a lot of guidance from parents and stuff like that?
As far as the school that I
chose?
chose?
As far as guidance and stuff like that, as far as did your parents help you make a decision and help lay out options and kind of help direct you in a way? Or was this, I mean, you strike me as the type of person that's just very inner motivated and nope, mom and dad are not out of the picture as far as the decision goes, but
so my parents, neither one of them went to college.
Same
My
as mine.
dad
Yeah.
is a very successful business owner. He has his own, plumbing business that he's had ever since I was a toddler. But he, it's a trade, and he never went to college. And my mom raised us 5 kids, so she never went to college either. So there wasn't really. It wasn't obviously discouraged to go to college and pursue a career.
But you
it
saw
wasn't,
a third door. It wasn't like one of those. You didn't come from a family who's like, well, you have to go to college. You have to have a 4-year degree. I mean, like, I think today, like, that's so driven. Like, everybody wants to be in a corner office or something somewhere. And so they're pushed so hard to do the bachelor's degree. And I think it's probably a little bit more common back then, but like today, if somebody goes, no, I mean, I don't think I want to be a social worker, and then to step out of a 4-year college after you've already been there, and take a different path, like that just seems crazy.
Really?
Yeah, like like if you put that situation today, be like, my God, you're ruining your life. You're not gonna, you're like, you're quitting school. Like, like you're gonna end up like selling watches and bubble gum on the streets or something like that out of the trunk of your car. Because like, oh, you're not going to have a 4-year degree.
Yeah. Well, no, but the thing is what I realized going to that private college after like a couple of semesters was that I was at the wrong place and doing the wrong thing. Even though I was trying to do something a little bit different and trying to find my path, I realized, no, this is the wrong area. I want to be a nurse, and I'm clearly at the wrong school because it was not a nursing school. But I also, my parents didn't have the finances to put me through college, so it was student loans for me.
Yep.
And I couldn't afford to pay $18,000 a year to continue going to private college. So I moved back home, and then I picked a community college that was nearby, and I paid my way through community college to go for my nursing degree.
Did you work through college?
I did. I worked 3 jobs.
So you were an NA, and what else did you do?
I worked 3 jobs as a nursing assistant.
Oh, geez.
Yeah.
Because you couldn't pick up the enough hours at one, so you like had to go to.
Well, one was on like one weekend a month. You would do like the whole weekend, overnights and everything at a group home. And then one was they were all part-time. And then one was part-time at a nursing home, and then one was part-time in a newborn nursery at a hospital. So there was like a wide range of like spectrum, a variety of like experience there. But the hospital one was golden because that was like getting my foot in the door to get in the hospital, because then you can like move all over the place once you're finally in. So
did you still live at home while you were going to school?
yeah, back then I did. Yeah, I moved off campus and then moved back home, and then applied for the nursing program, got in, and yes, lived at home. So
great way to save money. Like,
That-
hey, an
looking
extra, today at a lot of the college, I mean, it's like $7,000 per semester just to live on campus, or if you're on the cheap side, maybe it's $3,000. But I'm like, for 4 months, well, I'm pretty sure that I can find, a couple roommates in an apartment,
yeah.
and spend way less than $3,000. But no, talked about that a little bit last, in one of the last podcasts, was how, traditional versus non-traditional, and like you have a lot of flexibility with your living situation when you're a more traditionally aged student, and it's a great way to go. So if anybody is like, if you're thinking about going into nursing school and you're choosing a nursing school that maybe is a little bit closer to home and stuff like that, like, don't be afraid to, nobody's going to look down on you because you are, your parents are. If you go to your parents and be like, hey, can I still live at home for a little while I'm, pursuing this goal? I think most people's parents are going to be pretty supportive of that. Hopefully.
I agree.
Hopefully.
Yeah.
There's exceptions, but, so what, so you started off as an NA, you worked at 3 different places. So it was is it a child birth center?
Yes.
Birth center, group home, and then a hospital. It's more like a traditional NA role and stuff like that.
Yeah, the
and,
birthing
like a
center
med
was in the
surg.
hospital. It was a nursing home and then also a group home.
Okay.
Yep.
And then, so once you graduated from your associate's program, then where'd you go? What'd you do?
For work? Then I got a job in the hospital. I was able to quit all of those 3 jobs, which was like, hallelujah!
What are you doing? I don't know. Like,
I'm going to Disney.
Nothing.
Yeah.
I'm gonna go home and I'm gonna like sit. It's amazing.
Stare at the wall.
I did nothing and it was everything I hoped it would be. So now you have, well, but you said you worked all the way through. So did you graduate with no debt?
Well,
Or pretty close?
I paid cash for all of my nursing school, which was phenomenal.
Yeah.
I was like, this is awesome. It was way back when at that community college. This was 20 years ago. Okay. I make myself feel really old when I say that.
Okay, but 20 years ago was like 1999, so it's like not that big of a deal.
Like the best time ever, like the 90s. Okay?
I remember the 90s. I'm well acquainted with the 90s.
Okay, so even way back then, I think it was at this community college, it was like $37 a credit. When I had been going to that private college, it was like $500 a credit. It was like insane. So basically,
I'm not going to tell you what I'm paying for per credit at my program right now. It's like $8.25 a credit.
A credit?
A credit.
Oh my God.
And my program's like 52 credits.
Do you get chest pain when you think about that? No, I'm just kidding.
I'm old. Well, my grandpa died at age 40 from a heart attack, so I try to I think about that. I start getting chest pain. I start worrying about more than just debt. So we're not gonna think about no. I do. I have some scholarships through the military and stuff like that. So I'm not as worried about that kind of stuff. So okay. So where did you
Sure. Oh, so at work, right?
Yeah.
After graduation.
So where'd you work?
Since I was
what'd you do?
working at the hospital was my plan. My whole plan is I wanted to work in the hospital. Like from a young age, I was like, ooh, I like the hospital setting. So I got a job working on a medical floor in the hospital, and I worked there for a couple of years.
So like a normal med surg?
Med surg.
Normal kind of med surg. Like, was there a concentration in that med surg?
There were a lot of post-ops, like a lot of post-angios, a lot of post-ops. There was, at the time, I guess your general med surg.
Okay. So after med surg, how long did you work there as in med surg?
For about 2.5 years.
Okay, and then what?
And then after that, I moved away from that area. So in order to not have to commute so far, and then I started raising a family as well. So I got a job in a smaller hospital, doing like a float position. So doing med surg, floating also to started into postpartum, and then that's where I started to dabble into ER. And found out that I really loved ER.
It's not bad. ER is pretty awesome.
It is pretty awesome. I worked charge many of those shifts, and I worked at that smaller rural hospital for about 4 years. Before I worked at a different hospital after that. Just strict ER then for about 12 years.
Okay. And that's where our paths crossed.
That's where our paths crossed.
Cool. But now, like, how long? Because you took a new position in surgery.
I did.
Right.
Yes.
So, but you're full. Well, not full time, but you're full time in, FTEs and all that kind of fun stuff.
Yeah.
But you're full time in surgery now.
Just about. Yep. Which I love. It's each job that I've worked, like each stage, I feel like kind of leads you to your next phase that you go into.
Was it like what spurred a lot of the change though? So if you were like when you were, after a dozen years in the ER, I assume that like there's just a. Did you feel stagnated, or was it just I think I want to do something else, or like what spurred the change?
The need for something, how do I say this nicely? I was getting burnt out.
Okay.
I was totally getting burnt out in the ER. After 12 years, anybody who works ER, that you get to see a certain kind of population, and after 12 years, you need something that is going to give you different experiences so that you can still enjoy nursing. And that's what I needed. Mm-hmm. And now that I have that change, I'm back to really loving nursing again.
Sponsoring this segment of the Real Talk School Nursing podcast is nrsng.com. Go to the Real Talk School Nursing Facebook page or Twitter feed and click on the link to get your $1 trial. I found nrsng.com as a first-year nursing student, did my trial, and was hooked. Since then, nrsng.com has added tons of great content and continues to add more. nrsng.com is a complete education platform for nurses and nursing students and includes audio and video courses, cheat sheets for referencing information quickly and easily, a mobile app, a huge question bank, and a solid SimClex. nrsng.com is a complete solution. They aren't overpriced and have a lifetime membership. Not just preparing students for a test, nrsng.com provides a home base that members can reference anytime as a nurse. Go to the Real Talk School of Nursing Facebook page or Twitter feed, click on the link to get your $1 trial. That's nrsng.com, and don't forget to use the link on the Real Talk School of Nursing Facebook page or Twitter feed. All right, so we're back. So of all the units that you've been on and each of the jobs that you've had within healthcare, what are some of the best things what are the best things of each of the units that you've worked on, or maybe some of the best experiences that you've had on each, or maybe a couple of things that stand out? So go back to med surg, your first job as an RN.
Okay.
A really good experience, or kind of something that was you're like, yes, I'm in the right place, Well, I mean, you go all the way through school, and school is at times very not fun, and you could go all the way through that and be like, and even through preceptorship before you're given the full reign, the full yoke of responsibility of being a nurse, and you might you might get a job at a med surg unit and be like, wow, I am in the wrong place.
Right.
So what did you have, kind of not an epiphany, but did you have a point in your in that first job where it's just yep, I'm in the right spot?
Well, the first job was definitely a lot of learning. Mm-hmm. Because they say, you learn most of your nursing skills and everything actually on the job. Mm-hmm. And that's very true, because you learn all about your assessments and prioritizing and, actually talking to doctors when you actually have to do it. And, I definitely realized that nursing was the right path. I don't know if there's one single experience that I can recall. I think it was taking on the challenge of, no, okay, I'm not a nursing assistant anymore, I'm the nurse, and I have all this responsibility, and I have to take care of these 4 patients and juggle all this stuff, and it feels like a huge leap up. Mm-hmm. And
it's all the charting and all the stuff, the responsibilities that you had as a med surg nurse in the early 2000s. How have things changed over the last 15 years? I mean, just the amount, since I started as a tech, I think the amount of charting that you guys did as nurses has expanded, just in the 3 years that I've been there, and my preceptorship was the same thing. from the beginning of my preceptorship, things were added in the 6 weeks or whatever that I spent there, like doing my hours, like how like over the last 15 years, how have things expanded?
I feel like whenever they do changes to the computerized charting, there's more clicking of the boxes and less narrative writing. Where, when you come from nursing school back in the day, when I went to school, it was like always writing your notes.
The S bars and
and I think it was like, oh my God, this is coming back. I think it was DAR notes, data assessment and response. Wow, I just pulled that out. Like, where did that come from? But no, like you would write your notes and, there was so much like writing or, typing. Because on my first job we had computer charting, which was really good, because my second job we didn't. So it was like reverting back. But anyways, no, I think, as the computer systems and then with like billing and charging and all that, and they try to make things a little bit easier. I feel like it's more clicking things and then trying to find things to click and find your interventions. And then I feel like sometimes we're staring at the computer screens more than we're interacting with the patients. So it's trying to find that balance and kind of catch yourself from doing that and remembering, I can't just sit here and stare at this computer screen and try to find.
Yeah, but there's a lot of things that can happen. There's a lot of problems with, like if you didn't chart it, it didn't happen.
Oh, for
like,
sure.
You can you can legitimately get into a lot of trouble. You're like, yeah, I did that. I was like, well, why didn't you chart it? So I had like 6 patients. We were overrun by stuff, and yeah, I did it, but it's not charted, so I can't prove it. But like, so how? Well, that's another way deep we could forget the rest of the show prep and just like dig into that for the next hour.
Nursing charting.
Oh
Why
my
it
gosh.
sucks so bad. We should have scribes that follow us around, right? Like, how spoiled would we be if we all had like little scribes, like they do, like the docs do in the ER over at one of the hospitals.
Well, I think eventually you're just gonna have a, you're gonna be walking around with a tablet.
Yeah.
I mean, we're starting to kind of see that a little bit, where basically you have an iPhone or something like that, and you're charting things along the way. I mean, I think you're going to start seeing something like that. It's not going to be a person walking around with you. It's going to be an electronic device that's recording where you are and what you're doing, and it's coming. I think that's where it's going. So okay, so you did med surg, and then what was next?
When I did the charge nurse and then float nursing at another small hospital. Yep.
Okay. And then you came to the ER.
And then I came to the ER for...
So what was it like a standout experience in the ER for you? Or like what was a really great thing about working in the ER?
A really great thing about working in the ER was that it's like a huge adrenaline rush, like just around the corner all the time. We'd be sitting there at the desk shooting the breeze talking, and all of a sudden they're like, we need help out here, somebody's down and can't get up, and we're like, ah! And everybody comes out there, and all of a sudden, yeah, you're running a code. Stuff like that. And when I first started, and for at least, well, for most of the time that I was there, I loved it. I thrived on it. And all the time, every day was a new experience. You always had patients and making connections with the patients. I mean, there's tons of things that always happened that I always loved. And the closeness that you get with the physicians. There's a lot of respect. Generally, there's a lot of respect and a lot of camaraderie. If you have questions, they're happy to answer and explain things that they're doing. It's a very tight-knit group. And you feel like everybody always has each other's backs, and everybody's on a first name basis. It's it's a really great environment, and it's really great to work in and to grow in and to learn so much. It's such a broad area.
Yeah, you see geriatrics, you see pediatrics, you see oncology, you see it all.
newborns, like
Yep.
a baby, you'll
Yep.
have a 2-day-old baby and then you'll have a 101-year-old lady. Like, it's literally.
At the same time.
Literally.
At
Yeah.
the same time,
Right.
yeah.
So, it's like you get to know a little about a lot of things.
A lot of stuff.
So, trying to keep up on all that.
But like you still can't, like you get a lot of diversity, but you can't really rely on knowing a little about a lot of different things. Like you still have to, did it take like a lot of personal exploration into things? You're like, okay, I don't know enough about XYZ, and so you have to like do personal study time where you're digging into certain things, or do you rely on, or do you more rely on the experiences to teach you?
Honestly, the things, it would come up on like, education when we would get our trauma certification training, or, education. There was always education bundles that would come out. The facility that we work at, they're really good about continuously sending out education bundles. Felt like every time we looked at the computer, there was new education. Honestly, I don't know, it probably sounds bad to say, but honestly, I didn't really do a whole lot of like educational research outside of work. If I ever had a question about something, I would go back and have a conversation with one of the docs, and that would be like my little mini education session.
No, it's true. Like I think you have a lot more access to providers and stuff like that who have breadth and depth of knowledge about a lot of different things. And so like you like hey, I'm gonna skip searching for an answer for 4 hours at home. I'm just going to ask Mike if he can fill me in on this toxicology issue or something like that, because he was a toxicology fellow, or crazy
just go pick
crazy
their brain.
Oh yeah, it's I think that's a major benefit. It's like if you go to a med surg unit, like I don't know, I haven't seen a provider since yesterday. Like they made rounds today. I'm like, wow, I totally missed them. Like they're gone. And it's a little bit different at smaller hospitals than bigger hospitals. So I feel like there's a little bit more tight knit group at in our little med surg. All right, so we're back. So let's talk about your initial license RN program. So you waited a year after high school and then went. So what kind of challenges did you? You know what? Hold on. We're gonna take a pause because we have some cold beverages over there. Well, there we go.
They're still cold.
They're still cold. All right, ready?
Ready.
1, 2, 3. There we go. Thanks.
Cheers.
Cheers. All right. Go ahead. Full experience. You get the sniff.
Yeah.
It's mild. Not too sweet. Not bitter. So we're trying the Stella Artois Cider, made with hand-picked apples. So it's a premium cider. It's pretty mellow.
It's got just like a little tartness.
If it's important to you, it's a 4.5 ABV. So pretty mild in that sense too. So it's not gonna like you could drink one and not be like on the floor crying about a puppy you lost or something like that in the 3rd grade, which is I think positive for a late afternoon. I'm gonna give it. Let's see. What am I gonna? I'm gonna give this an 8.0 finger probes out of 10. 8.5 or 8.0 finger probes out of 10. How do you rate yours?
Oh boy.
You need another.
Well,
you need another
considering
swig.
that I'm not really a big beer drinker, this is very light beery on the taste. Mm-hmm. It's more like apple cidery.
Yeah, it's a cider.
It's really good. It's kind of refreshing.
And tart. So
Just a little tart.
So you got to come up with your own scale.
Oh, so I have to like make up my own
You
little
have to
things
make
to
up
say
your
at
own
the end
little.
of it?
Yep. On the
boy.
fly. On the fly.
On the
This
fly. Okay.
you might fail the podcast if you don't get this right.
This is all hanging in the balance.
This whole thing depends upon your scale process.
Oh gosh. I guess I'd give it a 7.5. 7.5. I have no idea.
You could do it.
7.5 marking pens out of 10. I don't know.
Nice.
Yeah.
Oh, like the ones with the orange cap that you put around like rashes and stuff like that.
Yeah, I'm thinking of the purple ones that the surgeons always use when they mark people's
always,
legs.
Like
Initial.
in the ER, they're like they have orange caps, but they're like it's a blue pen or something, isn't it? Right?
Yeah.
Nice. So 7.5 marking pens out of 10.
Yeah.
That's pretty solid.
Yeah.
That's a solid C. You can make it through nursing school at 7.5.
Oh boy.
There you go.
Yeah.
Not my nursing school. We're at 83, so that would be a fail. But all right. So what? You were a more traditional age student when you were going through your
Yes.
initial licensure program.
Yeah.
So what were some of the things like? What was a challenge that you faced when you were going through school?
Probably learning how to manage all my time, or my lack of time, I should say, just because of the schedules with 3 jobs.
Yeah.
And even though they were part-time, it was still 3 schedules. And then going to school full-time. So I think the biggest thing was time management.
Just time management.
And learning how to do that. And really, I'm pretty organized, as a just baseline. So it helped, but it really, when you got to pull your stuff together, you learn how to do it. You learn how to do it
Right.
fast. When I look back, I think, did I really work 3 jobs and go to school? How did
how's
that
it
happen?
possible?
How is that even possible? Yeah, how is that possible? But yeah, when you're in the thick of it, you just trudge on forward. And
Well, I think when you're really that busy and stuff like that, I think if people are going, well, I can't do school and work at the same time, I think, I think it's kind of the same as being a parent and going through school at the same time. Is you can't you can't put stuff into like, oh, I'm going to skip class, or, oh, I'll do that later. Like, there's no time later. Like, no, I am in school, and then I have 2 hours, and then I'm literally like studying as soon as class gets out. I'm writing this paper, or I'm doing this thing or something like that, and then you have to be at work at 5. Class gets out at 3, and you have to be at work at 5. At the same place. So
right.
like I think that's, in hindsight, probably a big benefit to have like a lot of things to do. So that's outside of nursing school. What's something that you hated or struggled with, or I hate to say it like that, but like I think we can kind of get a tendency going through nursing school to get a little bit of a self-pity. I'll have a little pity party every once in a while.
Absolutely.
Because it's hard. Nursing
hard.
school's hard. It's
Very much.
Having been through another bachelor program before, and then obviously going through prereqs and stuff like that, like nursing school is different. It is different, and I don't have like medical school to compare it to or something like that. And I don't want to say nursing school sucks, because I don't think. Well, it does suck, but I think it's more for me, like, the content isn't hard. It's the stuff that surrounds nursing school. It's the nursing school part that's hard, not the content, not the stuff that they're teaching you. I think that stuff is very manageable, very easy. Mm-hmm. Sometimes the volume can be a little bit tricky, but it's all the other stuff. So, like, what was something that you, like, that was a particular sticking point for you going through your initial RN program?
So like you said, hate is a strong word. I wouldn't say that I hated it, but I remember back when we had to prepare for clinicals. Like the night before, you would have to go and you'd have to I always felt like I was sneaking into the unit and like, you know, we weren't sneaking. We had permission to go, obviously, but I always felt like we were going in and you have to like look up your patient, look through their chart and like look at all of their, you know, their diagnoses, and you'd have to write up so many cardexes.
Yeah.
Like you have like these index cards, like the big index cards, because it was going to be written full. Like my fingers, I have a callus still. You know what I mean? Like it's on my
20
bone.
years later, it's like you have a bone spur from the...
Because I'm nursing school.
It's all nursing school's fault that I can't bend this knuckle all the way anymore.
It's because of those clinicals. No, but I remember like going in to prep for clinicals. You would have to write up all of their diseases, and you'd have to go home then with all your little notes, and you'd have to write up
all the meds.
You'd have to write up all of the pathophysiology about their diseases,
all the comorbidities, and
all of it.
Like, yeah.
You'd have to look up all their meds, and you'd have to write up separate med cards.
Yep.
What is the med? What does it do? What are the side effects? What is every single thing? And you'd be like, oh, can't we just get the medics book? Or not the medics book, you know, the book.
Yeah, the medication book. Like,
yeah.
Can we just look it up?
I
don't know what it is.
Gosh.
Why do I have to know this
yeah,
the day before?
I think it was prepping for clinicals that just kind of became burdensome because it was trying to like factor in that time. It was very time consuming, I remember. And then it seems like you would go in the next day to take care of your patient, and you kind of had an idea in your head about how things were supposed to go or how things were going to go on a perfect day.
And they never do.
Dun, dun, dun. Like you show up in your white scrubs and your white tenors and your cute little pony, and you're like, good morning. And then
I can guarantee that if I was in school with you, I would never show up in a ponytail.
no.
Probably. I mean, no.
No.
I mean, back in high school, I had enough hair for it, but today I don't.
I know.
So, what was like the care plans are like a really heavy part of nursing school and a really important piece of clinical. So, was it like what was what was the latest that you stayed up in order to do that prep?
Oh, good Lord.
It's like, one time I didn't go to bed. Because I can almost guarantee, like, knowing you and kind of understanding better, like, how things went. Like, you had work the night prior.
Oh, yeah.
And you worked until 11 or something like that.
Yep.
But for, you know, you had a short shift, or maybe you could get a couple hours off to go over and like get information and stuff
or
like
do it
that.
on my break or something.
Or something.
Yep. Mm-hmm.
And then like you worked until 11, so you're starting your prep work at 12, you know, and then worked all the way through until 4, and I'm sure you had to like
No, I would never stay up till 4. I would maybe stay up till like 1 or something, because I'm just like,
well, that's downright reasonable.
The little perfectionist, but yeah. I mean, it's not terrible. But yeah, but then you would show up and then half their medications were changed because the hospitalist would round after you were there and change everything and order a bunch of tests, and you're like, what the heck are all these tests? I don't know what this is.
Why is this why are you doing a different beta blocker? There's no difference in these two beta blockers.
I don't have a Cardex for that beta blocker. My instructor's gonna kill me.
Why don't you know about this, Emily?
Failed.
You're gonna fail clinical because of this. But it does feel like that when you're going through nursing school. It feels like any slip up is like your doom. It's your impending doom. It's still like that. So what kept you motivated? Like, what kept you going? Because I assume it was like a 2-year program. So
it was, yes.
Yeah.
Yep. What kept me going is that I didn't want to be a nursing assistant anymore. One, I didn't want to be working 3 jobs for the rest of my life as a nursing assistant.
Amen.
Amen. And just knowing that, I mean, there was a light at the end of the tunnel.
Right.
It's going, all suffering ends eventually.
I think last fall there was like one of my classmates is like a really good photographer, and there's this place on campus where the sun sets, and if you're walking like at a certain time of year, you're walking down this path, and there's like a bridge over the walkway, and the sun sets, and it's perfectly in line with the bridge in this pathway. And she took this picture, and it's this absolutely stunningly beautiful fall picture, and the sun's setting, and she takes a picture, and it's like light at the end of the tunnel, and we still have like, and I mean, because it was the end of our first year, our first full year, and so I think there is a transition between first year nursing school and like once you get into the second year, I think there's a little bit of a change. For us, it was like being in a different school for us, but it was like, but I had the like, I don't see light at the end of the tunnel. I see a sign that says tunnel ahead. So like we're getting there, but I'm like there's still a lot of time to and I think I'm probably one of the lower tier students in my program. Like there's some unbelievably academically gifted people in my program. Like we'll just be talking. We're like, oh, and I did this and this and this, and it was like, you just linked all three of those concepts together in your head. You told me about her. I'm still not sure I understand all the connections. Like, just
like, can you draw it on a chart? For
yeah,
me?
like, can you
draw me a picture?
but like knowing that there's most of the time nursing school's 2 years, so like you can put up with almost anything for 2 years.
Yeah.
It's doable, and if you're an 18-year-old, 19-year-old person going through it, it's just as doable if you are, in your mid-30s, or there was a gal that I started interacting with a little bit over the last week, and she's starting her nursing program. She's 48.
Wow. There's
another one that is in one of my groups. She's 51 and she's starting. Like, it's totally possible. Like, nursing school is like, if you're thinking about going, or if you're in the middle of it and you're like, I don't know if I can do it, like, I think that's you can. It's completely possible. There's plenty of people. You're not the only person who is 48. I've got a gal in my class who's 50. There's another gal who's in her late 40s, and she's been a surge tech, like first assistant or something like that for like 20 years. And she's got like 3 teenage children and going through and stuff like that. So
that's what I was going to ask you. So these older, like the 51 and the 48, is this just, everybody's got a different reason sometimes, but is it like a career change, or is it just like the kids are older now? I've always wanted to be a nurse. Maybe I'll start to go to school now.
I think for the gal who's in my class, we were actually just talking about this last night. She was always interested in the medical stuff, but she had kids early, and other family circumstances were going on and stuff like that, and so she put her life on hold, to take care of the stuff, and and then she was doing like sign language interpretation and stuff like that, and she's just like, I've had enough of this. Like, I'm going to nursing school. Like, and she was there. She had all the prereqs. She had been working. She's very, very bright. She's really smart and a very caring person and stuff like that. And she's just like, nope, it's time. And like like she still has family stuff going on. Like, she's taking care of her parents, I think, full time and stuff like that. Like, she's got a crazy, incredible, very busy schedule, and she's got a couple of kids who are youngish, so it's possible. Like, you can do it. Like, nursing school is not just for the young. Like, you can do it. Like, it doesn't matter if you're 50 or 19. Like everybody can, like, not everybody can make it through it, because there are people who don't, but you can do it. Like, if you're motivated and you work smart and you work hard, and you don't piss off too many nursing instructors, You can do it. So, all right. So we're kind of talking in the break there, and we're talking. We're like, am I answering everything okay? Yes, you're fine, and you're great and engaging and laughing, and she's like, well, you're asking really good questions, like, tell me about a time, like those interview questions, and you just love them. I can tell. You're like, you're itching. You're like, I want to go do another interview. Yes. Tell me about a time when you had a disagreement with a coworker. How did you resolve it, and what was the end result? Yes. Go. Yes. Yes, and that's how yes. she's gonna stonewall me on that one.
You got it.
So, all right. So let's transition to RN to BSN. With the previous host, Greg is actually going through his RN to BSN program right now. But he basically did it in line. I think he had between 6 months and a year between finishing his. He did a part-time diploma program or a part-time RN ADN program, and I think he rolled right into an RN to BSN.
Smart way to do it. Yeah.
So, what made you decide? I mean, after 18 years of being an RN, what made you decide to go back for an RN?
So, when I graduated, originally, way back, in 2000, I always knew that I was going to go back and get my 4-year. But when I first graduated and I first started working, all of a sudden I was making more money. And I was like, woohoo! And I wasn't in school for a little while. I'm like, I'm just going to take a little break. I'm just going to take a year.
What was because today, like the initial pay difference between like a basic RN and a BSN is like $1.25.
Yeah, I think that's what it is.
So was it similar back then, or was there a bigger jump? I mean, it seems like there's a greater. Was there as much emphasis on the BSN back then? Like, were they pushing it as much,
Not that I recall. I don't recall them saying, I recall them encouraging, the BSN and, saying good things about it, but I don't recall, like in the last 5 years or so, there's been a lot of, hullabaloo about, no, we're really encouraging, that all of the RNs have their BSN by such and such a date, and, with tuition reimbursement and all of these other motivators for staff to go back to school, they're really trying to push for it. I don't recall that so much originally when I went to school. So I always knew that I wanted to go back, but I wanted to take a little time off first, and really I shouldn't have. In hindsight, everything's always easier to see in hindsight. So I shouldn't have, because then I had a family, got married, built a house, and then several years later, went through other things like divorce and all sorts of other stuff. But then as my kids got a little bit older, that little voice was like, okay, now it's time to go back. You really need to get it done. It's always been kind of bugging me. So, after working as an RN for 15 years, because it took me a few years to do this, because I went part-time. I went very part-time, because I was working a couple of jobs. I was a single mom of 2 kids. I couldn't take more than 1 to 2 classes at a time.
How old were your kids
when I started? My son was 10 and my daughter was 13.
Oh, well, then they can make sandwiches for each other and stuff, at least, right?
Make a sandwich. Yeah.
Make a sandwich.
Oh, yeah. And
Why did you get the chainsaw out of the garage? You're making sandwiches. Why is this happening? So, what was so some of the challenges? I mean, like, okay, so you've got a family, you've got a mortgage to pay.
Yeah.
Like, so you're single momming it. So how did was there ever an option for you to just be like, nope, I've got to go to school full time? But is an RN to BSN program designed for you to keep working?
So I went online. There's so many online programs, and I actually there was a bunch of colleagues that were going to school online as well, or had gone through the program. So I was kind of getting some feedback from them. They were going to a few different programs. I was getting some feedback from them on which one sounded like it would be the right fit for me. And so I picked a program, and it's one where you go at your own pace. You choose which classes you want to take when. I liked that flexibility because I like to kind of have control over what I'm taking and when, and for taking summer classes or not taking summer classes, all that kind of stuff. I'm sorry, what was the question?
Was like it's designed like an RN to BSN is designed to keep you working. Like they're not like my program straight up told people like well, to back up, my program advertised itself as a weekend and evening, and advertising were like, it's for adults, it's a second. We all understand that, people have families and, this is a second degree. And so, classes are convenient in the evening and on weekends and stuff like that. And then you get there and like, instructors and the director straight up telling people like, if you want to stay in the program, you have to quit your job.
Oh no.
And like, for somebody who was in a single mom position, like that's you're getting poleaxed. So like, there's no way.
Yeah, no.
So because of the flexibility and stuff like that, like are most RN to BSN programs designed to be workable while you're working?
I don't know about all programs, but it's my understanding that most online programs are, because I think you have the flexibility. I think there's some online programs that kind of already have the itinerary kind of laid out. Like the classes are already pre-scheduled, and this is what you're taking first, second, and third, and so forth. Whereas I completely chose what I was, for the most part.
Right.
Some classes you had to take one first before the other, but there was some
It was way more
flexibility.
Modular. Yeah, it was way more
There
modular.
was some flexibility. There was the core nursing classes. There were 9 nursing classes, and then a few liberal arts classes that I needed to take. So
just to get the whole well-rounded education part. Yes. So what were some of the things, because you were working at the time, so while you're like, what kind of advice did you get from other people who were going through the RN to BSN program while you were going, that kind of like tipped you over the edge to say, yep, it's the right time, like it's convenient enough for my lifestyle and stuff like that? Like what kinds of things like drove you to say, yep, it's time?
I think, the big thing was the flexibility. Another nice thing was tuition reimbursement through work.
Okay.
And that was kind of another benefit of going at a snail's pace.
Because
it was slow and long torture, for 3 years. I don't recommend that you go for 3 years, but I only paid for like 3 of my classes.
Right.
Because tuition reimbursement paid for all of it. So
how much is the and every system's going to be a little bit different, but what's the what was your per annum did you get from work?
Oh, for reimbursement allowance, it was $3,000 a year.
Okay, so that's reasonable, but that's only while you're in school. Like you can't graduate and then they keep giving you if you keep going, right?
Right.
Okay.
So yeah, I guess the flexibility of the program was just a big thing.
Was there any, were there things at the end, like now you've just graduated? If you could have a conversation with Emily 3 years ago, like what kind of stuff would be like, I wish you would have known that, or things that just came up. You're like, I hadn't considered this. I wish I would have known this ahead of time.
Good or bad?
Good or bad, yeah.
Part of the reason that I had put off the BSN program for so long is because I didn't want to write papers. I guess I didn't realize quite how many papers there were to write. There's a lot of writing. A lot of writing, a lot of projects, a lot of presentations, a lot, like, weekly discussion posts. But kind of like before, you do it. You do it, you get through it, and when you're done, it's like, oh, hallelujah.
Was the technology change difficult?
How so? What do you mean, like being online student rather than traditionally going in?
Well, I remember, like, when I went back to school to do prereqs and stuff like that, like, my original bachelor's was, I mean, it was a traditional 4-year brick and mortar college or university, whatever, and it was like, email was just a thing, you know? Like, we had a LAN, a local area network and stuff like that, so, like, people couldn't, I think we were just getting onto Google, I think, at the time, maybe.
Okay.
So, and then all of a sudden, I go back and there's this D2L thing, and I'm like, oh my God,
What the heck is that?
what is this? And
Yeah.
how do you, like, it's like the technology piece took some time to kind of move forward. Like, was that a big hurdle?
No.
No?
I felt like I caught on pretty quickly. And then, like, creating PowerPoints and using Microsoft Words to make APA format papers. APA! Like, I'll hear that in my nightmares.
Shoot me.
Yeah, I know, right?
Like, the instructors be like, stop judging me by the 6th edition. Like, you're using number 4. You're using the 4th edition. I'm using the 6th edition. And, like, why did it change? First off, why did it change? Like, the instructors are still like, no, you told me that 6th edition. Damn it. Ugh. But like, D2L wasn't, like, too big of a hurdle or anything else like that,
No.
so.
I personally didn't feel it. I felt D2L was relatively easy to navigate. But I didn't really have an issue. I mean, I don't consider myself a computer whiz by any means. You know what I mean?
Neither are most of my instructors. Like, and they're administering it from that side.
Oh,
so
good.
hopefully.
But it was user friendly, and I figured out my way to do most of it. I had a little trouble figuring out how to get online when I had to do my capstone presentation, but once I finally got that, everything was fine. But no, it was the technology. I wouldn't say was an issue.
So, from kind of a macro level, how has education changed? Like, and maybe that's, you can say I don't know, because it's a hard question. But, like, how did education change between, your initial RN to the RN to BSN? Like, how did education change between those two things?
Like the material, do you mean?
Or
the content, or what do you...
I think we learn today in different ways than they taught. I think education has changed in the last 20 years, but I think how we learn, or how we expect to learn, is a lot different. If I can use an example, like, one of my classes was a flipped classroom, which I was just like, so a flipped classroom is the instructor is there to kind of facilitate and organize things, but it's the students who are teaching each other content instead. And, it's it was like the advanced pathophysiology and stuff like that. I'm like, huh. So we're paying tons of money for the instructor, and she's sitting quietly in the back while I'm learning from somebody who's, no further into the book than I am, I mean, so, but it's like they say if you want to learn something really well, figure out how you have to teach it to somebody else. So I understand that a little bit, but like I think I'm still stuck in education from 20 years ago, where it's like, no, I just want to sit and
Take notes.
well, absorb. Like you are an expert in this subject. Like, shine your light upon me, to help me learn this, in a 3-hour block of instruction here. But like, did you find that there was education pieces that were like, no, this, like, I can't learn like this, or this is too new age, too weird, or something like that?
So we didn't have anything like the flipped classes like you're describing. I've never even heard of that before, but that's definitely an interesting concept. So, when I went to initial schooling, it was like you described, the brick and mortar, going to class, taking notes, or having all of your clinicals. So much more traditional in the sense of going to school. And then with online, that's like a whole different way of going to school altogether. However, it's much more independent learning anyways, so it's very self-driven. The teacher, or the instructor will send out their syllabus and be like, hey, this is the whole semester. This is what you're supposed to read. These are the discussions, these are the quizzes, these are the papers, these are the projects.
Go.
And they offer guidance, they offer feedback, they're very supportive. The instructors that I had experience with, I'd say were 95% amazing. But it was very self-driven, very self-guided. So,
I think that's a pretty big change.
Yeah.
What was So I think initial licensure programs are very similar in the amount of pressure that they put on students and stuff like that. I think there's a discussion to be had, but a couple of my friends think there's a lot of hand holding. Like, oh, I know it's hard.
Really?
It's okay. Like there's a not from instructors so much but from people in support positions. Or I think there's a lot of students who like, well, this is really hard, and therefore you should feel sympathy, or you know what I mean? Like there's either a desire for hand holding, or there just is hand holding. People are either wanting a hand hold, or people are wanting to hold somebody's hand.
I wonder if that's just a general culture change then.
Could be.
Rather than a teaching style change. You know what I mean? Like with how this could be a whole different topic too, but like
I promise you that none of the instructors that I've gone through have offered to hold my hand.
I feel
but I think I'm still in an initial licensure program, and I think especially in my mind, I imagine that initial RN programs, or to get that initial licensure, those are tough, like purposefully very, very tough and very stringent and stuff like that. Was the BSN program different from that?
Yes.
Like, is there a recognition, like, yes, I understand you already have your RN, like, we are,
let's lift you up, and so the associate's degree, I feel like there's a lot of weeding out. When you say sure, the instructors are tough, I agree with you. I didn't experience or witness a lot of hand-holding whatsoever. It was like the first semester, I felt like a third of the class was gone. All of a sudden it was like, oh, where's Joe Schmo? Where's Sally? No, they're gone. They disappeared. They couldn't make it. Like, people are crying, people are leaving. It's like, okay, well, see you later. Don't let the door hit you on the way out. It was that kind of an attitude. Wow. That's what it felt like anyways, It's like, goodbye. But that's kind of what the instructors expected. Like, we started out with this huge auditorium, and by the end it was like maybe
only
half.
The first couple rows are filled up.
Yeah. It was like maybe half of the class that was left. Jeez. But that was what was the expectation from the instructors. They knew that was going to happen going in, that they
Do you-
were going to be weeding out half of the
I wonder if there
class.
was a greater expectation for weeding out in like an associate's program where you have more 18-year-olds. Like,
I think so, because I think maybe they don't realize like what these kids are getting into, like what nurses actually do, because there's so much teaching of like technical things, like this is how you check a blood pressure, and this is how you start an IV, and this is how you give a bed bath, or like this is how you do all this basic stuff. And then they get into more of the stuff like, okay, these are all the diseases that are the most common that you're going to come into contact with to treat, you know, and these are all the drugs that you need to know, and this is how you talk to people, and this is how you talk to doctors, and this is how you get along with your coworker. You know what I mean? It's like that was all the stuff I felt like in a 2-year program. It was like memorization of facts and like really fast, like learn this, go, you know, practice on these people over here while we watch you, and you graduate.
if you screw up, death.
Yes. But then with the bachelor program, like you said, like we're established nurses already, you know, varying amounts of time, because there's a wide range of ages in bachelor programs. But I felt like the professors were much more of in a supportive role. Like they're like, okay, now this is like teaching you about more in nursing other than just like you have the practical skills down.
Right.
You know how to prioritize, you know how to assess, you know how to do all this, you know about diseases and drugs. Now let's talk about what else there is to nursing.
So what kinds of things, like what was the focus of the BSN that brought you beyond the RN? Because you're, like you said, like the skills are there, the prioritization is there, like, you know, like all that stuff is there. So what was the extra stuff? Like, what is it that brought, what's the extra value that brought, or that the BSN brought to you?
You know, there's a huge focus on evidence-based practice. You know, researching evidence-based practice.
EVP.
EVP, you got it. You've heard that a time or two.
What?
So, you know, everything is about evidence-based practice. And everything is about, you know, holistic patient care, providing holistic patient care, being culturally, ethnically sensitive, which, you know, I felt like, I think most of us are, well, I guess I can't speak for most of us, but I feel like we got some of that too, but, you know, in the
certainly
initial
in an ER,
program.
yeah, certainly in an ER, you're exposed to every cross section. I feel like
You are.
and especially, I mean, especially if you're like in a larger city or larger metro area and stuff like that. Like, you're getting the full cross section.
A lot of diversity.
Lots of that. I mean, maybe in our more regional hospital, we don't see as much diversity, but we're still seeing every cross section, from, you know, the good dog. We're getting, you know.
That's my puppy.
Oh yeah, come visit. Gotta check in with mom, make sure everything's okay. Everything's okay, Max? Good dog. But you know, you're getting less diversity, but you're still getting everything from like the, you know, the wealthy grandma to, you know, the
Homeless people.
the homeless people and you know, everything in between. So what are the things that you're happiest about, like, of the skills and of the things that you learned in the BSN program? Like, what are you happiest about? Like, what are the things that are like, I'm walking away happy knowing this?
I felt overall it was really a great learning experience, honestly. I think it helps you think like on more of a leadership, you know, and more of a, I don't want to say managerial, that's not the right word, but more of a like leadership, even when you're not even when you don't have the title of a leadership position.
So you do think that it did provide like leadership training and stuff like that?
Yeah, to be a leader even when like you're working as a staff nurse.
Right.
Because even, people that are working as staff nurses, we're all working as leaders and need to be like examples, and yeah, absolutely. I felt like it was there was a lot of really good learning, and it provided a better
Please don't knock over the microphone, dog.
all of a sudden dunk.
It's gonna be interesting.
It provided a way to show how, you integrate all that evidence-based, and you show like how you integrate nursing theories and learning theories, how people learn differently, and to provide more competent care. He's thirsty too. He's drinking some cider.
I think it's just water. It's just water. Talk to somebody who's looking at an RN who's looking at a BSN program. Like, what kinds of things should someone consider as they're looking at that kind of program, as they're looking at an RN to BSN?
So something that's going to work for them personally. There's different programs. Like if you are gonna drive somewhere, like you are, to drive to a university or a building or wherever it's at,
across a major metropolitan area.
There you go. And if that works for you, then that works for you. Or if you need to do an online program, there's different amounts of flexibility, I think, too, in the online programs. So just research them a little bit, or maybe ask around if you know people that have attended those online programs, and ask them about the pros and the cons and see what they like about it and see if it sounds like a right fit for you. But I would definitely pursue going for your BSN, because it is worthwhile just to have the opportunities that are going to be available, for opportunities for change.
Advice for somebody who's just generically looking at the nursing field. Broad.
Just
like,
generically looking at the nursing field?
Like, so if I'm thinking about becoming a nurse, and I go and I just happen, we're in an airport or something like that, and I sit and, oh, you're an RN? Well, I was thinking about nursing school.
You know what came to mind? You know those pictures that you see of like the 90-year-old lady who's like, nursing school? So, or be a nurse, they said. It'd be really fun.
Yeah.
I'm 30 years old.
Yeah. Like, nursing school isn't, or being a nurse isn't stressful.
Yeah.
I'm 36 and I feel great.
I feel fine. That's what I thought of. That was the initial thought that came to my head when you said, if someone wants to be a nurse, what would you say? No, I'm just kidding. Kind of. No.
Are you though?
Are you though? No, the thing about nursing that's actually really great is that there's so many different areas that you can work in. Like, you can do direct patient care, or you cannot do direct patient care. Or you can do direct patient care in a clinic, or in some other kind of specialty office, or in a hospital, or in a nursing home, a group home. The possibilities are really endless.
I was really surprised last night. We were kind of talking, because we've all done our preceptorship now. So we've already, and when I say preceptorship, like, one of the other schools in our area that has a similar program to mine, they had like 80 hours, and we had like 225 hours. Like, whew, okay, that's a lot.
Yeah.
And then, but we get done with that, and, and people are just kind of, now that they've had time to digest some of that experience, people are like, yep, I think I'm going to, I was totally set on labor and delivery, it seems like half the class was, oh yeah, definitely going to labor and delivery. And then they get through the labor and delivery preceptorship, and they're like, yeah, I think mental health is where I'm gonna go. Like, I was really surprised by how many people were like, yep, going to mental health. Like, that's my jam now. Like, that is, like, I was really surprised, and I was really surprised by, it's, it's, because I know what my interests are and stuff like that. Like, it's really surprising how diverse people, like, their desires and what areas they can go to. But you can.
It takes all kinds. And that's
And
the
you can
beautiful thing
change your
about it.
mind, and you can change your mind.
You can. You can work a couple of years here, and then if you don't like it or you get sick of it and you want to change, you can work a couple of years over here. And it's really not frowned upon. It's just a change.
So, any advice, good old hearty advice for nursing students? Maybe as I'm sitting at the edge of a dime waiting for the next 90, I have less than 90 days.
That is amazing.
90 days.
That is amazing. You can do it.
I know.
I
know I can. I just
So I would say if you're going to be a nurse, I would straight, like, go on, get your BSN for sure. Like, I should have done many, many moons ago. You know, like, I would just go straight for the 4-year. I know that you're going for your master's straight off,
Yep.
which I just learned this evening is even a possibility, which is awesome. Like, that's another thing. Like, you always learn something new. It's like there's things that are constantly evolving, or has been around for a long time.
But and I don't think when you say go for your BSN, I don't think that you're communicating that there's something wrong with getting an associate's degree.
No.
Obviously, you went from you went the full spectrum. You were an NA and then an RN and now a BSN, and you've done med surg and charge nurse and float pool and
ER.
And now surgery. I mean, so that slow progression through things, like, don't, when Emily says don't, go for your BSN, I don't think what I don't think that you mean is go directly to it or do everything right away. If you can, great, but there's nothing wrong with taking that event, like that, a longer term approach to it, right?
If you want to. I'm just saying sometimes it might be a little easier just to get it all done up front, because I feel, I don't know, at least for me personally, going back to school as an adult with kids, trying to manage everything as an adult, like a home, kids, work, and another work, it's very challenging to juggle all of that. And it's it seems like as you get older, time management,
you have less control over your time management.
It gets challenging, because especially when you've got little monsters running around the house that are trying to constantly, they want you and they want to spend time with you.
But your monsters are like in their teenage years now,
well,
right?
now they are, now that I'm done, yeah. And now they finally get their mom back, and you should see, like, how happy they are, because they've been neglected for 3 years. Like, they're, like, in the corner eating a crust of bread.
What'd you do tonight? I sold bubble gum out of the back of the car just to make ends meet, Mom.
Yes. No, I'm not trying to be offensive or, like, to say anything's wrong with being a 2-year, because I was a 2-year for 15 years, so I wouldn't say anything. I'm just saying my advice would be, if you have the opportunity, I would go straight for the 4-year. I wouldn't wait like I did for 15 years. I would just get it all done. Mm-hmm. Because
if you can.
Because it's makes life a little easier down the road for yourself.
What about, so somebody finishes and they've got their, they pass their NCLEX, and now it's their first day on the floor. So somebody walks into, a new not a new grad, but a new grad RN essentially walks onto the floor. Like, what, and you're reaching out your little wing to, like, come here, buddy. let me tell you about some stuff. So like what kinds of like closing thoughts for people who are in nursing school and they're looking forward into the next year and saying, okay, like I'm going to be a nurse in a year. What kinds of things would you want them to know or hope that they bring forward from their experience?
Right. I would say that there's going to be hard days for sure, but to keep going, because there's also going to be really good days, especially as a new nurse, as you're learning. I think most jobs have like some kind of a mentorship. They like pair up a experienced nurse with a new nurse, and I would really take advantage of that if they do, or even if they don't. Like, I don't know, find a nurse buddy.
Go find
a nurse buddy and buddy up with them, because you're going to need someone to be a support person, at least one person to be a support person, because there's going to be a lot of stuff that happens and you're going to have a lot of questions. You're going to have a lot of questions, period, and don't be afraid to ask questions, because you would rather ask a question than make a mistake. And people do not mind answering questions. Nurses anyways, if it's helping out a new grad. Yeah. And with the docs, I'd say stand your ground. Stand your ground.
I'm gonna be able to do this. It was awesome chatting with you. I had a lot of fun today, and I'm really excited to keep this podcast rolling and help more nursing students just like me get through this fun we call nursing school. If you like the podcast, smash that subscribe button, and remember to leave only 5-star reviews, because that's the only ratings that count to get us noticed by more nursing students. So go to wherever you download podcasts, subscribe, rate us, review us right into the show. realtalknursing@gmail.com, and please share the show with other nursing students. Remember, one team, one fight. We can get through this together.
This Real Talk School of Nursing podcast is a BKD production. Produced by BKD. Sound studio provided by Emily and Max. Yawns provided to Emily by late nights in busy hospitals. Bowl licking sounds provided by Max the dog. Refreshment provided by Stella Artois Cider. The Real Talk School of Nursing podcast is a holy moly, I can't believe you're still listening to this podcast.